You are welcome to my channel. I remain Dr. Uduak. I want to wish you, I want to say compliment of the season and wish you a Happy New Year in advance. By tomorrow, we'll be entering 2025. So I want to wish all my subscribers a Happy New Year in advance. A happy and a prosperous New Year in advance. And I believe that next year shall be better. Now, I want to say a very big thank you to all my subscribers. I want to appreciate every one of you that have been supporting my channel. I want to thank you for the likes. I want to thank you for the comments, all the beautiful and wonderful comments that have been coming in into my channel via you. I want to say a big thank you. Thank you very much. And I want to assure you that we'll keep making you happy, and we'll keep dishing out good educational contents to you that will help you, especially our students, that will help them in their academic and all that. Thank you very much. Thank you very much, and thank you very much. Today we are going to do multiple choice questions and answers. I will be asking the questions, and then I'll ask the questions. You can drop your answers on the comment section, and I believe that is going to be a wonderful session. Thank you very much as you tune in. Now we are going to begin with I think the first question we have here. We have a lot of questions here. The first one we have is is a very simple one. It says, "What is human anatomy?" What is human anatomy? Please, you can provide the answers if you have joined us. What is human anatomy? What is human anatomy? Okay, the first option here is human anatomy is the study of the functions of the body parts. B is human anatomy is the study of the structures of the human body. C, human anatomy is the study of bacteria and viruses. Excuse me. The human anatomy is the study of disease and its cases. So please, if you know the answer, you can drop the answer on the comment section. Okay, let me provide the answer. The answer to the first question is B. Human anatomy is the study of the structures of the human body. That's the answer for this particular question. Now let's go to the next question. The next question is, what is human physiology? What is human physiology? The first option is human physiology is the scientific study of the mind and behavior. B, human physiology is the study of the internal and external structures of the human body. C, human physiology is the study of the functions of the body parts. D, human physiology is the study of microscopic organisms. So you can provide the answers. I'm waiting for your answers. I'm waiting for the answers. Okay, let me say the answer. The answer is B. The answer is B. Human physiology is the study of the internal and external structures of the human body. Now let's go to the next question. The next question is, how many bones does an adult human skeleton have? How many bones does an adult human skeleton have? You can drop the answer on the comment section. How many bones does an adult human skeleton have? How many bones does an adult human skeleton have? Okay, let me mention the options. A is 205 bones, B is 207 bones, C is 209 bones, D is 206 bones. The answer is D. The answer is D. In the skeleton of the adult human, there are 206 distinct bones, and the bifurcation is given. Okay, yes, the answer is D, which is 206 bones. Yeah. The vertebral column is 26, the skull is 22, the hyoid bone is 1, the ribs and sternum is 25, the upper extremities are 64, the lower extremities is 62, the auditory ossicles are 6. Now, the next question is, which of the following parts of the human skeleton forms the helmet for the protection of the human brain? Which of the following parts of the human skeleton forms the helmet for the protection of the human brain? A is the cranium, B is the temporal bone, C is the hyoid bone, D is the mandible. Please, you can drop your answer on the comment section. Which of the following part of the human skeleton forms the helmet for the protection of the human brain? The answer is A, the cranium. Cranium forms the helmet for the protection of the human brain. Now, number 5, how many bones does human ankle has? How many bones does human ankle has? Now, the answer to this question, okay, let me mention the options. Number 1 is 7. Sorry, A is 7, B is 6, C is 9, D is 8. So, tell me the answer. You can mention the answer in the comment section. Let me repeat the question. How many bones does human ankle has? Number A is 7, B is 6, C is 9, D is 8. The answer is A. Human ankle has 7 bones. Now, let's go to the next question. Which of the following type of cartilage is present at the joint of the long bones in humans? I repeat, which of the following type of cartilage is present at the joints of the long bones in humans? A is fibrous, B is hyaline cartilage, C is elastic cartilage, and D is calcified cartilage. So tell me the answer. Which of the following type of cartilage is present at the joints of long bones in humans? Which of the following type of cartilage is present at the joints of long bones in humans? A is fibrous cartilage, B hyaline cartilage, C elastic cartilage, D calcified cartilage. The answer is B. Hyaline cartilage. Now, the next question is, which of the following human ligaments is called Y-shaped ligament of Bigelow? Which of the following human ligament is called Y-shaped ligament of Bigelow? A is the glenoidal labrum, B is the scapula, C is iliofemoral ligament, D is pubocapsular, D is pubocapsular. So you can tell me the answer. You can drop your answer in the comment section. The answer is C. Iliofemoral ligaments. Now, the next question is, which of the following structure keep blood flowing unilaterally? Which of the following structures keep blood flowing unidirectionally in humans? Which of the following structures keep blood flowing unidirectionally in humans? A is bronchiole, B is neuron, C is septum, D is valves. Which of the following structures keep blood flowing unidirectionally in humans? A is bronchiole, B is neuron, C is septum, D is valve. The answer is D. The answer is D. Valve normally allows blood to flow in only one direction. Now, the next question is, which of the following is the vestigial body part of the human skeleton? Which of the following is the vestigial body, which of the following is the vestigial bony part of the human skeleton? A is cranium, B is coccyx, C is cervical, D is clavicle. I repeat, which of the following is the vestigial bony part of the human skeleton? A is cranium, B is coccyx, C is cervical, and D is clavicle. The answer, okay, drop your answer. You can drop your answer in the comment section. What is the answer? You can drop your answer. But the answer is B. The answer is B, coccyx. Coccyx is the vestigial bony part of the human skeleton. Now let's go to the next question. Which of the following clinical sign indicates ischemia of forearm? Which of the following clinical sign indicates ischemia of the forearm? A is carpal tunnel syndrome. B is hand of benediction. B is hand of benediction. C is ulnar claw. D is Volkmann's contracture. A is, okay, let me repeat the question. Which of the following clinical sign indicates ischemia of forearm? Which of the following clinical sign indicates ischemia of forearm? A is carpal tunnel syndrome. B is hand of benediction. C is ulnar claw. D is Volkmann contracture. The answer to this question is D. D is Volkmann contracture. The next question is, which of the following is the structural and functional unit of the human nervous system? Which of the following is the structural and functional units of the human nervous system? A is the brain, B is axon, C is dendron, D is neuron. The answer to this question, okay, let me not mention the answer. You can drop the answer on the comment section. You can drop your answer on the comment section. Let me repeat it again. Let me repeat the question. Which of the following is the structural and functional units of the human nervous system? A is the brain, B is axon, D is dendron, and C is dendron, and D is neuron. The answer is what? Who can tell me the answer? The answer is neuron, D. The answer is neuron. All right, let's move on. What does corpus callosum connect in human brain? What does corpus callosum connect in the human brain? What does corpus callosum connect in the human brain? What does corpus callosum connect in the human brain? A, 2 optic lobes. B, bone and muscles. C, 2 cerebral hemisphere. D, 2 lobes of pituitary gland. What does corpus callosum connect in human brain? A is 2 optic lobes. B, bone and muscle. C, 2 cerebral hemisphere. D, 2 lobes of pituitary gland. The answer to this question is C. C is 2 cerebral hemisphere. The next question is, which of the following parts of the human brain has a center for controlling breathing? Which of the following part of the human brain has a center for controlling breathing? A is medulla oblongata, B is diencephalon, C is cerebrum, D is cerebellum. I repeat the question again. Which of the following part of the human brain has a center for controlling breathing? A is medulla oblongata, B is diencephalon, C is cerebrum, D is cerebellum. The answer to this question is what? Is A. The answer is medulla oblongata. The medulla oblongata is actually a cone-shaped neuronal mass that is responsible for autonomic functions. And this part of the brain is the center for respiration and circulation. Now, the next question is, how many pairs of the spinal nerve are found in humans? How many pairs of the spinal nerve are found in humans? A is 33, B is 31, C is 13, D is 12. A is 33, B is 31, C is 13, D is 12. Let me repeat the question. How many pairs of the spinal nerve are found in humans? A is 33, B is 31, C is 13, and D is 12. The answer is B. B is 31. We have 31 pairs of the spinal nerves. Now, the next question is, which of the following taste bud is present on the lateral sides of the human tongue? Which of the following taste bud is present on the lateral sides of the human tongue? A, bitter, B, salty, C, sour, D, sweet. I repeat, which of the following taste bud is present on the lateral sides of the human tongue? A is bitter, B is salty, C is sour, D is sweet. You can drop your answer. The answer to this question is C, sour. Now, the next question is, which of the following is a balancing organ in humans? Which of the following is a balancing organ in human? A, eardrum, B, vestibular region, C, cochlea, D, organ of Corti. Please drop your answer. Drop your answer on the comment section. I repeat the question again. Which of the following is a balancing organ in humans? A is eardrum, B is vestibular region, C is cochlea, D is organ of Corti. The answer to this question is what? Who can mention the answer? Please drop your answer. Drop your answer. Drop your answer on the comment section. The answer to this question is B. B is vestibular region. The vestibular region is actually responsible for balance. Now, the next question is, which of the following part of the parietal pleura covers the superior surface of the human diaphragm? Which of the following part of the parietal pleura covers the superior surface of the human diaphragm? All right. I take the question again. Which of the following part of the parietal pleura covers the superior surface of the human diaphragm? Which of the following part of the parietal pleura covers the superior surface of the human diaphragm? Nerves. B is pneumothorax. C is mediastinal pleura. D is diaphragmatic pleura. So you can drop your answer on the comment section. You can drop your answer on the comment section. Which of the following part of the parietal pleura covers the superior surface of the human? A is intercostal nerves, B is pneumothorax, C is mediastinal pleura, D is diaphragmatic pleura. The answer is D. The answer is diaphragmatic pleura. Now, the next question is, which of the following hormone helps in the secretion of HCl from stomach? Which of the following hormone helps in the secretion of HCl from the stomach? A is gastrin, B is secretin, C is pepsin, D is renin. A is gastrin, B is secretin, C is pepsin, and D is renin. The answer is A, gastrin. Gastrin is a hormone that is produced by the G cells in the lining of the stomach and upper small intestine. Gastrin stimulates the stomach to release gastric acid. The next question is, which of the following cells in the pancreas make insulin? Which of the following cells in the pancreas make insulin? A, epithelial cells, B, hepatic cells, C, germ cells, D, islet cells. So you can drop your answer. You can drop your answer on the comment section. The answer to this question is D, islet cells. Islet cells are responsible for producing insulin. The next question is, human placenta is derived from dash. Human placenta is derived from dash. A is amnion, B is chorion, C is allantois and chorion, D is allantois. I repeat the question again. Human placenta is derived from dash. A is amnion, B is chorion, C is allantois and choroid, and chorion, D is allantois. So you can provide the answer on the comment section. You can mention it on the comment section. You can just type the answer on the comment section. I will see it. The answer to this question is B. The answer is B. B is chorion. Now, let's move on to the next question. What is a human heart made up of? What is a human heart made up of? A is tissues, B is muscles, C is skin, D is bone. What is a human heart made up of? A is tissue, B is muscle, C is skin, D is bone. The answer is B, muscle. Which of the following instruments is used to listen to the internal sounds of the human body? Which of the following instruments is used to listen to the internal sounds of the human body? A is sphygmomanometer, B is suction device, C is stethoscope, D is reflex hammer. I repeat, which of the following instrument is used to listen to the internal sounds of the human body? Which of the following instruments is used to listen to the internal sounds of the human body? A is sphygmomanometer, B is suction device, C is stethoscope, D is reflex hammer. Who can provide the answer? Mention the answer in the comment section. You can mention the answer in the comment section. I repeat, which of the following instruments is used to listen to the internal sounds of the human body? A is sphygmomanometer, B is suction device, C is stethoscope, D is reflex hammer. The answer is C. The answer is stethoscope. Which of the following is the largest gland in the human body? Which of the following is the largest gland in the human body? A is the thymus, B is the kidney, C is liver, D is pancreas. A is thymus, B is kidney, C is liver, and D is the pancreas. The answer to this question is the liver. The liver is the largest gland in the human body. Now, which of the following human cells produce insulin? A is beta cells, B is F cells, C is alpha cells, D is delta cells. The answer is A, beta cells. Detoxification of the lipid drugs. Detoxification of lipid drugs and other harmful compounds in ARO is carried out by dash. Detoxification of lipid drugs and other harmful drugs in the endoplasmic reticulum is carried out by dash. I repeat the question. Detoxification of lipid rocks and other harmful compounds in endoplasmic reticulum is carried out by dash. A is cytochrome D, B is cytochrome F, C is cytochrome BF, D is cytochrome P450. You can answer in the comment section. The answer is D. The answer is D, cytochrome P450. Which of the following is known as the study of the human population? Which of the following is known as the study of the human population? A is geography, B is anthropology, C is ethnology, D is demography. A is geography, B is anthropology, C is ethnology, D is demography. The answer is demography, D. Which of the following type of placenta is found in humans? Which of the following type of placenta is found in humans? A is discoidal, B is zonary, C is diffuse, D is cotyledonary. The answer to this question is A, discoidal. Now, which of the following helps human sperm with locomotion? Which of the following helps human sperm with locomotion? A, flagellum, B, basal body, C, nucleosome, D, cilia. The answer is A, flagellum. Division of human egg is dash. The division of human egg is dash. A is holoblastic and equal. B is holoblastic and unequal. C is isoblastic. D is meroblastic. The division of the human egg is dash. Holoblastic and equal. B is holoblastic and unequal. C is isoblastic. D is meroblastic. The answer to this question is B. B is holoblastic and unequal. Which of the following is the innermost layer of the human eye? Which of the following is the innermost layer of the human eye? A is retina, B is choroid, C is sclera, D is cornea. The answer to this question is A, retina. Retina is the innermost layer of the human eye. Which of the following control breeding rates in humans? Which of the following control breeding rates in humans? Which of the following controls breeding rates in humans? A, cerebellum, B, hypothalamus, C, thalamus, D, medulla oblongata. Which of the following control breeding rates in humans? A is cerebellum, B is hypothalamus, C is thalamus, D is medulla oblongata. The answer is D, medulla oblongata. The next question is, what is the structural and functional unit of the nervous system? What is the structural and functional units of the nervous system? A, neuron, B, dendron, C. Axon, D. Brain. The answer to this question is A. The answer is A. What is the structural and functional unit of the nervous system? A is neuron, B is dendron, C is axon, D is brain. The answer is A. Nerve cell does not divide because they do not have dash. Nerve cell does not divide because they do not have dash. A is nucleus, B is centrosome, C is Golgi body, D is mitochondria. The answer is B, centrosome. The answer is B, centrosome. Node of Ranvier. Node of Ranvier is found in dash. A. Muscle bundles. B. Dendrites. C. Right auricles. D. Axon. The answer to this question is D. Axon. How many types of neurons are present? How many types of neuron are present? A is 2, 1, B is 1, C is 3, D is 4. The answer is C, 3. There are 3 types of neurons that are present. They are actually the sensory neurons, association neurons, and the motor neurons. Neurotransmission through a synapse is always from dash to dash. Neurotransmission through a synapse is always from dash to dash. A. Axon and dendron. B. Dendron and axon. C. Brain and spinal cord. D. Spinal cord and brain. The answer is A. It is from axon to dendron. Reflex action is controlled by dash. Reflex action is controlled by dash. A is the spinal cord. B is the autonomic nervous system. C is the peripheral nervous system. D is the sympathetic nervous system. The answer is the spinal cord. Connection between axon and dendrites is called dash. The connection between axon and dendrites is called dash. A. Synapses. B. Synapse. C. Desmosome. D is tight junction. The connection between axon and dendrite is called A. Synapses. B. Synapse. C. Desmosome. D. Tight junction. The answer is B. Synapse. From where does the formation of a neural tube take place? From where does the formation of a neural tube take place? A. Ectoderm. B. Endoderm. C. is mesoderm. D. Spinal cord. From where does the formation of a neural tube take place? A is ectoderm, B is endoderm, C is mesoderm, D is spinal cord. The answer is ectoderm. The anterior end of the neural tube becomes dash. The anterior end of the neural tube becomes dash. A. Spinal cord. B. Brain. C. Axon. D. Backbone. The anterior end of the neural tube becomes B. It becomes brain. The neuronal migration is the method by which neurons travel from their origin to their final position. A. True. B. False. I repeat. The neuronal migration is the method by which neurons travel from their origin to their final position. A is true, B is false. The answer is A. It is true. Which is not true of glial cells? Which is not true of glial cells? A is neuron support cells. B, retain ability to divide in adults. C, are not able to divide in adults. D, develop from glioblast. Develop from glioblast, sorry. I repeat the question. Which is not true of glial cells? A, neuron support cells. B, retain ability to divide in adults. C, are not able to divide in adults. D, develop from glioblasts. The answer is C. They are not able to divide in adults. How many lamina are present in the gray matter of the spinal cord? How many lamina are present in the gray matter of the spinal cord? A is 8. B is 9. C is 7. D is 10. The answer to this question is D, 10. We have 10 laminas that are present in the spinal cord. All right. All right, let's continue. Centromere is required for dash. Centromere is required for dash. Centromere is required for dash. A, transcription. B is crossing over. C, movement of chromosomes towards the poles. D, cleavage. Centrosome is required for dash. A, transcription. B, crossing over. C, movement of chromosomes towards poles. D, cleavage. The answer is C. Centrosome is required for the movement of chromosomes towards the poles. Polytene chromosomes are formed due to dash. Number 1, endomitosis. Number 2, A is endomitosis. B, meiosis. C, mitosis. D, endomysis. The answer is A, endomitosis. Racus particles occur in dash. Racus particles occur in dash. A is mitochondria. B is nucleus. C is chromosomes. D is Golgi complex. The answer to this question is A, mitochondria. Cell membrane is dash. A, semi-permeable. B, permeable. C, selectively permeable. D, impermeable. The answer is A, semi-permeable. Which of the following does not have a membrane? Which of the following does not have a membrane? A. Ribosome. B. Mitochondria. C. Nucleus. D. Chloroplast. A is ribosome. B. Mitochondria. C is nucleus. D is chloroplast. The answer is A. Ribosome. The cell theory was proposed by Dash. A. Viaco. B. Robert Hooke. C. McClintock. D. Cleiden and Swan. The answer to this question is D. Cleiden and Swan. There is no DNA in Dash. There is no DNA in Dash. A. An enucleated ovum. B. Mature red blood cell. C. Hair roots. D. Mature spermatozoa. There is no DNA in Dash. A. An enucleated ovum. B. Mature red blood cell. C. Hair roots. D. Mature spermatozoa. The answer is B. Mature red blood cell does not have a DNA. Cell theory is not applicable to Dash. A. Virus. B. Bacteria. C. Fungi. D. Algae. The answer is A. Cell theory is not applicable to the virus. Histones. Octoma contains A. 8 types of histones. B. 5 types of histones. C. 8 histones of 4 different types. D. 6 types of histones. The answer to this question is C. 8 histones of 4 different types. Now, let's take the next question. How many types of blood groups are present? How many types of blood groups are present? A. 1. B is 2. C is 3. D is 4. The answer is D. We normally have 4 types of blood group. They are the A, B, O, and AB type. Which of the following blood group is considered a universal donor? Which of the following blood group is considered a universal donor? A is A, B is type B, C is type AB, D is O. Which of the following blood group is considered a universal donor? The answer is D, O. The antigens for ABO and rhesus blood groups are present on Dash. A. Plasma. B. White blood cell. C. Red blood cells. D. Platelets. The antigens for ABO and rhesus blood groups are present on Dash. The answer is C. They are present in the red blood cells. Which of the following blood group is referred as a universal recipient? Which of the following blood group is referred as a universal recipient. A is type A, B is type B, C type AB, D is type O. The answer is C, type AB. What are the two blood tests? What are the two blood tests? A is resource and ABB. B is ABO and resource factor. Sorry, let me take it again. A is resource factor and ABB. B is ABO and resource factor. C is ABO and resource and RON. D is ABC and resource factor. The answer is B, ABO and resource factor. What is the process of transfer of human blood known as? What is the process of transfer of human blood known as? A is transfusion. B is processing. C is transporting. D is transferring. The answer is A, transfusion. Which is the rarest blood group? Which is the rarest blood group? A is AB negative. B is AB positive. C is O negative. D is O positive. The answer is AB negative. Who discovered blood groups? Who discovered blood groups? A is Thomas Colley. B is Karl Landsteiner. C is Camillo Golgi. D is Ernest Hacker. Who discovered blood group? A is Thomas Colley. B is Karl Landsteiner. C, Camillo Golgi. D, Ernest Hacker. The answer is B, Karl Landsteiner. Resource group was discovered in dash. Resource group was discovered in dash. A is 1930, B 1940s, C 1950s, C 1950s, D 1960. The answer is B. Resource group was discovered in 1940s. If the blood group of an individual is A, then the antibody present is dash. A is anti-B antibodies. B is anti-A antibodies. C is anti-O antibodies. D is anti-OA antibodies. If the blood group of an individual is A, then the antibody present is dash. A is anti-B antibodies. B is anti-B antibodies. C is anti-O antibodies. D is anti-OA antibodies. The answer is A, anti-B antibodies. Which blood type can be transfused to the individual whose blood type is unknown? A is AB positive. B is AB negative. C is O positive. D is O negative. The answer is D, O negative. In determining phenotype of ABO system, dash is required. O is dominant over A. B is dominant over A. C, O is recessive. D, A is dominant over O. The answer is C, O is recessive. From where does the aorta originate? A, right ventricle, B, left auricle, C, right auricle, D, left ventricle. The answer is D. How many aortic valves are present? How many aortic valves are present? A is 2, B is 3, C is 4, D is 1. The answer to this question is C, 4. We normally have 4 valves. The aorta distributes dash type of blood. A, oxygenated blood. B, deoxygenated blood. C, mixed blood. D, cannot be determined. The answer is A, oxygenated blood. Name the valve which is associated with the aorta. A is the mitral valve. B, the aortic valve. C, tricuspid valve. D, the pulmonic valve. The answer is B, the aortic valve. Which artery supplies oxygenated blood to the liver, stomach, and abdominal esophagus? Which artery supplies oxygenated blood to the liver, the stomach, and abdominal esophagus? A is bronchocephalic artery. B is costocervical artery. C, mesenteric artery. And D is the celiac artery. The answer is D, celiac artery. Name the artery which supplies blood to the diaphragm. Name the artery which supplies blood to the diaphragm. A is internal iliac artery. B is the pancreatic artery. C is inferior phrenic artery. D is carotid artery. Name the artery which supplies blood to the diaphragm. The answer is C, inferior phrenic artery. Name the major artery of the head and neck. A, thyrocervical artery. B, colic artery. C, external carotid artery. D, suprarenal artery. The answer is C, external carotid artery are the major arteries of the head and neck. Which of the following is not one of the 3 major branches of the colic trunk? Which of the following is not one of the 3 major branches of the colic trunk? A, right gastric artery. B, left gastric artery. C, the splenic artery. D, the common hepatic artery. The answer is A, right gastric artery. Which is the only organ to receive arterial supply from all 3 branches of the colic trunk? A is stomach. B is spleen. C is liver. D is pancreas. The answer is A, stomach. Which artery supplies to a tail of pancreas? Which artery supplies the tail of pancreas? A, left gastric artery. B, right gastric artery. C, common hepatic artery. D, splenic artery. The answer is D, splenic artery. Okay, let's go to respiration. During inspiration, the diaphragm dash. During inspiration, the diaphragm dash. A, reflexes to become dome shape. B, contracts and flattens. C, expands. D, shows no change. During inspiration, the diaphragm dash. A, reflexes to become dome shaped. B, contracts and flattens. C, expands. D, shows no change. The answer is B. During inspiration, the diaphragm contracts and flattens. Lungs are covered by dash. Lungs are covered by dash. A, pleural membrane. B, peritoneum. C, pericardium. D, muscles. The answer is A, pleural membrane. The total number of alveoli in both the lungs is dash. A is 3,000. B is 30,000. C is 5 million. D is 7 million. The answer is D, 7 million. Lungs have large number of narrow tubes called dash. A is alveoli. B is bronchioles. C is bronchi. D is trachea. The answer is B. The alveoli of lungs are lined by dash. A, squamous epithelium. B, simple epithelium. C, cuboidal epithelium. D, columnar epithelium. The answer is A, squamous epithelium. How many unpaired cartilage are present in the larynx? How many unpaired cartilage are present in the larynx? A is 2. B is 3. C is 4. D is 1. The answer is B, 3. The thyroid cartilage has a posterior margin that forms superior and inferior horns. True or false? A is true. B is false. The answer is A. It is true. The thyroid cartilage has a posterior margin that forms superior and inferior horns. The superior horn of thyroid cartilage is connected to which bone? A is vertebra. B is ribs. C is hyoid. D is epiglottis. The answer is C, hyoid bone. Larynx is found at which vertebral level? Larynx is found at which vertebral level? A, CV3, cervical vertebrae 3 and cervical vertebrae 6. B, CV6 and CV3. C is CV2 and CV5. D is CV5 and CV2. The answer is A. Which of the following connects margins of the lateral masses of atlas with those of posterior articular surfaces of axis? A, articular capsules. B, posterior atlantoaxial. C, anterior atlantoaxial. D is the transverse. The answer is A, articular capsules. Which of the following is covered by parathyroid gland? Which of the following is covered by parotid gland? Which of the following is covered by parotid gland? A is the articular disc. B is sphenomandibular joints. C is temporomandibular ligaments. D is stylomandibular. The answer is C, temporomandibular ligaments. Name the ligament that connects the anterior and posterior surface of the 7 costal cartilages. A. The costoxiphoid ligaments. B. The radiate sternocostal. C. The interarticular sternocostal. D. The articular capsule. The answer to this question is A. The answer is A. 4. Ligament connecting bones of the pelvis with each other may be divided into dash groups. A is 3, B is 5, C is 2, D is 4. The answer is D, 4. The most important mechanical function of the pelvis is to transmit the weight of trunk and upper limb to lower extremity. True or false? The most important mechanical function of the pelvis is to transmit the weight of trunk and upper limbs to lower extremity. True or false? A is true, B is false. The answer is A. The sternoclavicular articulation. The sternoclavicular articulation is a dash arthrodial joints. A. Single. B. Double. C. Triple. 4. D is 4-layered. I repeat. The sternoclavicular articulation is a dash arthrodial joint. A is single. B is double. C is triple. D is 4-layered. The answer is B, double. The sternoclavicular joint is a type of dash joint. The sternoclavicular joint is a type of dash joint. A is hinge joint. B is ball and socket. C is saddle type. D is pivot. The answer is C, saddle type. Acromioclavicular joint is partially filled with a thick pad of cartilage known as meniscus. True or false? The answer is A, true. Well, I want to thank you for taking part in this question and answer session. And I want to thank you, and I want to assure you that we'll keep doing this so that it can boost your academic performance, especially my students. I will keep doing this for you so that it will help you to boost your academic performance, so that you can start making A's and start blasting your exams and all that. Thank you very much. I hope to see you when next we meet. Thank you.